Emotion close up and from afar. Joining us now, Rebecca Berry, Dr. Rebecca Berry. She's a clinical psychologist and child adolescent psychiatry professor at NYU School of Medicine. Good morning.
Morning.
Yeah, it's hard to say good morning, right? When
it is.
We were saying during when the piece was running, Carlos's piece, we're tired of discussing this. We're tired of talking about this. It's emotionally draining. You saw Melissa Joan Hart, how she described it. We had one of the counselors who went to the reunification center yesterday, and I asked her a very similar question is, people are dealing with this close up and from afar. The country is dealing with it. How do you measure? How do you deal with it? What do you tell people who have the same feelings as we do and who are dealing with it really much more personally than we are?
Right. I think that there's a lot of heaviness around this topic, in addition to a lot of frustration and some warranted anger, and really some confusion about what happens next. What are we going to do? We've all been seeing this happen more often. And I think that, you know, what stood out about Melissa Joan Hart's message is the impact on youth, right? Youth are continuing to have to really continue to hear about this, see this, and for some, unfortunately, experience it. So what is the impact that these events are having on our youth?
Yeah, I mean, it turns your stomach to see the little kids holding hands and, you know, streaming out of school.
That picture from the bus yesterday, remember?
The picture, it's like this, you know, evocative image that is now associated with this. But what we're learning about the shooter themselves and this mental disorder that we are told, emotional disorder, excuse me, that the shooter was being treated for, still able to access these guns. But I think people have questions about that because the shooter's parents have said they did not believe that they should own guns.
Right.
And I think that has raised questions of the connection there. And also saying, you know, just because someone has an emotional disorder does not mean they're going to commit a mass shooting at a school.
Absolutely. I think you're right on in that. And I think the narrative that we have coming out of this and the relationship that some may be making between having a mental health condition or a mental health disorder and the ability to carry out and act like this, I think that that's a really sort of, you know, that's not an immediate connection that we want to make. Certainly, I think a person that we've seen that individuals can have mental health conditions underscoring some of these actions, but that doesn't necessarily prompt anybody to commit something like this. This was a very heinous and calculated act.
Listen, you know, always in Washington, D.C., everything is political, right? And everyone wants to do everything they can except, well, many people, I should say, want to do everything they can except talk about guns.
Right.
They want to talk about mental health issues, which is a legitimate part of it, but it's not the only thing. Tennessee does not have the so-called red flag law that allows courts to seize firearms from people who are in danger. There is a law that bans possession if someone has reported mental health issues. Doctors in this situation, right? Healthcare workers, do they have any means of reporting and stopping people from being able to do this?
From my understanding of the red flag laws in the state of Tennessee, it is, a mental health practitioner or a physician would be warranted to report if there was an indication where a person has expressed stated means to commit harm against themselves or against others, or if they have been hospitalized in some way for said reportings, right? And I'm not quite clear on the background, but I do believe that that was not the case here.
The mental health part is a really big part of it. That's a good point. And so if that is something that you know someone is struggling with, what is a sign that you look for something like this? Because I think that is often one thing we talk about is ways to prevent this, not just how to react, it's how to stop it from even happening in the first place.
Right. Well, I think that collectively there can be some telltale signs. What we would most really look for apparently would be expressed or some leakage of intent to commit harm, some planning around such an incident like this. Behaviorally speaking, you would look for, a heavy isolation and any significant changes in a person's behavior, possible substance use. But again, that would really possibly require somebody who is close to the person who knows them to be monitoring those behaviors or to really kind of say, hey, that doesn't seem to be characteristic, or I am privy to this information about what may be happening for them.
I just want to 30 more seconds with you because I think this is really important.
Yeah.
Yesterday I was walking the dogs. I don't have kids yet, but I saw this kid coming home from school, right, and getting off of the bus and just like, the parents embracing. Right now, it's 6:12 in the morning. Parents are getting their kids together, ready to go to school, right? They're fighting, I don't want to put on the coat or what have you. This little beautiful kids. And I'm wondering, what do you say to those parents? Because some of them are taking pictures so they can remember what the kids were wearing.
Right.
Right, in case something like this happens. What advice do you have, doctor?
Right. I think that every parent every day, deals with their own anxieties about how that young kid is going to be. And then in the wake of news like this, in the wake of tragedy, I think it gets a little bit harder to kind of have any certainty about how things are going to go for my child. And I think that, as parents of young kids and to themselves, I think we have to provide ourselves a sense of reassurance that, hey, we can do something hopefully about this, and I'm going to reassure myself and my child that there are people that care about them and that are looking out for their well-being, and that we trust that. Even though sometimes I think in the midst of feeling these emotions right now, it can be really hard to say that and to really feel that.
Yeah, when I saw that yesterday, I said that at least 3 parents, right? 9 of them really,
Right.
and many, many more loved ones around them that won't be able to have that moment with their kids ever again.
It's devastating.
Yeah.
And you hope that in some ways people can put these emotions into action.
Thanks, doctor.
Thank you, doctor.
Thank you.
Really appreciate the advice. Thanks for coming on. Now.